Hello, everyone. My name is Danielle Rahajassan, and on behalf of the National Center for Medical Legal Partnership and our panelists, I wanted to thank you for taking time out of your very busy schedules today to attend this session. It is my absolute pleasure to welcome you to our HRSA-funded event, which is the second session of a four-part learning collaborative that will focus on using legal services as part of a community strategy to improve maternal and child health. In just a moment, I'll turn this presentation over to our panelists, but before that, I have a few small housekeeping things I'd like to run through with everyone. Everyone did join in on mute. However, if you have questions, please don't hesitate to type those in the chat so that panelists can see them and connect with you. Today's audio recording and slides will be made available to participants of the collaborative. Be sure to look out for an email from NCMLP early next week for those and information about the next intersession work as well. We will be joined today by the same amazing panel that you saw in the first session, but you will hear specifically from Vicki Girard, Loral, Patchen, and Roxy Richardson from the Georgetown University Health Justice Alliance team, who will be leading today's content. And I know you were all very excited to hear from them. So without further ado, I will pass it on to you, Vicki.
Thank you very much and welcome everybody. Good afternoon, happy St. Patrick's Day. We really are glad to see you all back with us, and we appreciate those of you who completed the homework from last session, which really helped us kind of frame what we wanted to cover today on ways to collaborate across both law and medicine. Wherever you are on your MLP journey, our goal is today to share some broad-based MLP lessons and approaches that you can use in your own practice. But since we are going to be delivering this through the lens of our own MLP around the perinatal law project, I'm going to turn it over to our director of that program, Roxy Richardson.
Thanks, Vicki. And hello, everyone. So for context, our MLP is integrated within the perinatal practice. And so our referrals come directly from Loral's health team and the patients that are seen by that healthcare team in the clinic. So it is an efficient way and critical way to meet people where they are and to help alleviate that barrier of access to services that many of those patients face. And that is why we want to encourage others to consider the model. And so part of the homework was to identify issues that you currently face in your practice. And as you can see, there are a lot of similarities between the practices and the locations. Laura?
Sorry, I had some technical issues today. Hi, everyone. So when I saw this word cloud, it was very, in a way, just comforting because we are all dealing with very similar issues. These were the things that were coming up to the surface in our setting. And they were the pieces of care that we knew were harming our patients, were making it very difficult for them to be able to adhere to their own medical management plans in the way that they would like to. It was also very distressing for the healthcare team because a lot of times folks felt like we weren't able to address these things in spite of knowing what the kind of interference that they created in terms of our ability to support patients and to deliver good outcomes and to partner with them around their care. What was difficult was sort of finding our way to an MLP, and we ended up getting there sort of by happy accident in terms of introductions in DC. And without that sort of outreach, I'm not sure that we would have ended up, landing in this position.
Thanks, Laura. Yes, so one of the ways that happened when we see all of these, you see benefits, family, transportation, education, insurance, Social Security. So yes, those are similar issues that are happening across the country and across practices. So because we are an academic MLP, we leverage students to help us with kind of synthesizing this information. And so we decided to conduct a needs assessment within the various departments and practices in the hospital to identify areas to prioritize. So as you can see, we have unstable housing, employment, public benefits, family law, insurance, financial issues, domestic violence. So those were some of the areas that kept on coming up. And so we needed to find a way to consider what legal services and what capacity we had to deliver those legal services. And so because employment and housing came up at the top, we decided to prioritize the beginning of our services, our legal service that we were going to provide to patients to be those two areas. And we did that, and we helped that by, going on to the next, which is once we determined what those unmet legal needs were, via the needs assessment, we needed a way to identify, we needed a way for the healthcare team to identify those issues so that they could refer those cases to us. So the team at MedStar already screened for social needs. And so we came up with a way to determine if those social needs had legal remedies. And so we started with the basic screening tool and conducted trainings to help those providers identify those issues. But again, it was a learning curve. It's not something that everybody got right away, right? I mean, it takes time to get a program like this integrated within a healthcare system or healthcare team that already has their own way of doing things. And so the reason for the screening tool also was to increase the appropriate referrals. And so we took that to the next level by providing specific guidelines. So towards the end of today's session, you will see what that screening tool looks like now in practice. And so we wanted to continue on by providing those trainings. As you see on this slide, what types of trainings we did. Again, this was a practice who did not have an MLP already in place. So we wanted to make sure that the team was comfortable with an MLP. Because we were asking them to identify legal issues, they had to know how to issue spot and how to refer those cases to us. And so again, since we decided to start with employment law, we did a training on employment law matters, getting them just a quick refresher on the laws in the DC and Maryland area. And so additionally, we wanted folks to feel comfortable, and we wanted to establish trust and early communication early on. So those early meetings that we had on screening, we created those short 5-minute training videos. Again, we know this is a healthcare team, over capacity, overextended. So we wanted to do bite-sized lessons on these issues. So again, they can kind of think about it as they are referring those cases to us. Yeah, I'll turn it over to Vicki.
Thanks, Roxy. So I think kind of the biggest message that we're delivering based on our own experience is what we describe as always trying to get everyone who is in the medical legal partnership practicing at the top of their license. So identifying the issues that the lawyers are feeling expert in and feel comfortable with, balanced against kind of where the providers feel like they're hitting barriers where legal advocacy could be helpful, balanced against the kind of the patients and the population needs that you're facing. And we make that sound like that was easy for us to kind of figure out. It wasn't. We're talking here, 3, 4, 5 months of effort to get to that place. And then I think the other thing that's really important to recognize is we're always going to have more need than we're probably going to have capacity to deliver. So one of the things that Loral and Roxy did really, really well was work together to kind of leverage their other community connections so that when we hit issues that we weren't able to take, we were able to do what we hoped were warm handoffs or referrals. So rather than just giving someone a phone number to go to legal aid for housing intakes on Thursdays, trying to connect them directly with a specific attorney, which we thought would be for this patient group, especially important given all the other struggles that they were facing all the time. And so what we want to do, and we know we have a range here of people who already have an MLP, and those of you who are still just thinking about it. So we wanted to give ourselves as much time today in the breakout rooms to really dig in a little bit and see, okay, in the context of a perinatal patient situation, how can you identify the issues that are going to be presenting themselves? And globally, and the goal is, again, even if you're here because your primary interest is around children and pediatrics, we want to give you things that you can transfer to your own practice. So thinking broadly about when you identify those issues, who, if we're operating at the top of our licenses, is going to be the best person to take on that challenge. And then for those of you that don't have any experience or exposure to working with a legal team yet, hearing from some of those law partners about what they can offer in terms of collaborating with you and what you can provide to make their advocacy stronger, to really kind of give you a sense of the MLP model. So we are going to go into our breakouts and use the case study to practice some of those skills.
Okay, so I wanted to share, so this might have come up. It definitely came up when we talked earlier about the screening tool, right? So I wanted to show everybody what it looks like. So this is the beautiful screening tool that we created for Laurel's team. And so this is for the social work team in particular, because our referrals do come from the social work team, although providers, the midwives, the nurse navigators, the entire team can make referrals to me. We gave this to the social workers who do that additional, like I said, there's a social screening that they do. And so when they are doing that second part of that screening, they have this chart to go ahead and ask, well, once a patient identifies an issue, as you can see from the left column, so if they identify an issue, we ask that the providers or the social worker, the healthcare team, they collect this relevant information on the right-hand side before making a referral to us. And that is to determine if it is an appropriate referral and what additional steps need to happen. And so we picked this is page 1 of 4. So this is not the entire slide. This is just for the purposes of this session today, but it does go through all of the various issues that we do in-house, and then also some issues that we don't handle in-house. But as Vicki mentioned, we do have relationships and partners with other local legal services organizations in and around DC, Maryland, and Virginia that we will conduct a warm handoff. And so if those patients do have needs that we cannot handle in-house, we will refer them out.